Hi, I'm Peter Kennedy and you're watching Market 1 Minute. I'm here with Dr. Lisa Crossley, CEO of Reliq Health Technologies. So Lisa, can you tell us a bit about the company and explain its relevance to the healthcare sector?
Sure. So Reliq Health Technologies targets the community care market. It's a very large and rapidly growing market that's anticipated to be worth approximately $43 billion by 2019. And community care is really everything after a patient is discharged home from hospital. So we have essentially two components to our platform. The hardware component is really focused on creating a virtual ICU in the patient's home so that we're able to provide really comprehensive, consistent, frequent monitoring of the patient's vital signs and movements in the home. And then the software component is essentially a Facebook for the entire care team. So in the community, when a patient's discharged home, you have the attending physician, the family doctor, personal support workers, nurses, allied health professionals, and they have no way to communicate amongst one another other than phone and fax. So we've created a secure online care collaboration and communication platform that keeps everybody in the loop.
Who are the customers and how do they pay for the technology at this time?
So we typically sell to hospitals who are trying to reduce readmissions and improve the health outcomes of their patients post-discharge. And the payers are the government health systems in socialized medicine countries like Canada and the UK. And in the US, the payers are the HMOs, so the health insurance companies, and Medicare and Medicaid, which are government funded.
And who are some of your key customers right now?
So we've had tremendous traction in the US where there is a real financial pain point. Medicare and Medicaid are actually penalizing hospitals for readmissions. It's costing hospitals significant revenue if patients are readmitted, and that's something our system directly prevents. So we are working with Sacred Heart Health System. They're part of the Ascension Health Network, which is the largest Catholic not-for-profit health system in the US and one of the largest global healthcare systems. Sacred Heart treats 30,000 inpatients a year. And we're also providing a wellness app, a white-labeled version of our software, to the city of San Antonio, which they will be rolling out to their 1.4 million citizens.
So really this sounds like a story that involves technology that allows people to be treated at home instead of in the hospital.
That's right. It's a combination of remote patient monitoring and this secure communication and collaboration platform so that family members who have, say, an ill elderly relative who lives far away can really keep track of their vital signs, their movements, are they taking their medication on a regular basis. Their clinical care team for the patient receives automated alerts if the patient gets a high blood pressure reading or if they forget to take 2 doses of their medication in a row. And the family can receive automated alerts if, say, grandma doesn't move around much during one particular day or misses an initial dose of medication. So it really gets the entire circle of care involved in that patient's care. And we know that translates to better health outcomes and therefore lower costs of healthcare and better quality of life.
Lisa, are there other social benefits that you'd like to discuss?
My favorite aspect of Reliq Health is that we're going to be able to do very well as a company by doing good. So the current model for healthcare is not sustainable. We can't continue to apply human resources to the community care model. We just won't have enough people. And the cost is very high. Our cost to use this technology solution is 1/10 the cost of applying a human resource solution. Beyond that, treating patients in the acute care space versus bringing them home and allowing them to be treated at home. In the acute care, there's a much higher risk of medication errors and infection. So if we can move care out of the acute care setting into the community care setting, not only are we radically reducing the cost to the healthcare system and therefore making the healthcare system as a whole more sustainable, we're also driving better health outcomes and better quality of life for patients and their families.
And for investors who are following the story, what can they expect to see in the near future?
Well, we've already seen that we have great traction in the US, and we are targeting a large and growing market that's anticipated to be worth $43 billion by 2019. We're at an inflection point for growth as a company. We're certainly the first mover, so we have a great opportunity in this market. And next year we'll be launching a consumer version of our app that's aimed not as much at the patient population, but more at citizens, residents who are aging in place, so the elderly who are still independently living at home. And I fully expect that by 2019 we'll have at least $150 million valuation. We're undervalued now, so it's a great time to get in.
So Lisa, this sounds like a very fascinating company, one that investors will want to focus on. Thanks for taking the time to talk to us this morning.
Thanks very much, Peter.